Now let's go over some basic insurance terms. I want to make sure that you understand some of these difficult vocabulary. Premium. The premium is the amount that you pay to purchase the insurance coverage. We talked about premiums before when we looked at car insurance. The premiums, when we looked at the car insurance providers, were given in 6-month periods because for car insurance you pay once every 6 months. So our premium there was maybe $300 or $500. In healthcare, your premium will probably need to be paid every month. And this can vary very much. If you are generally a healthy young person that isn't doing anything very dangerous, any activities that are dangerous, you may have a very low pay for your premium. But premiums can get very high, especially if you have any pre-existing conditions or a history of needing medical care, or if you're older, the premium, the monthly payment that you would need to make could be $1,000, $2,000. Your deductible. The deductible is the amount that the insured person must pay, what you must pay before the insurance company starts paying. For example, you might have to pay a $250 deductible each year. Most times, you will have an amount that is set as your deductible for a year's time. So if I'm with an insurance company and I'm paying for medical insurance for 1 year, they will say, well, whatever medical care that you need, you have to pay the first $250 of that medical care. Then we'll pay the rest. Or you have to pay the first $500 or the first $2,000. The higher your deductible is, the less your monthly premium will be. The same as what we looked at when we looked at car insurance. You have a deductible also in your health insurance. Co-insurance. Co-insurance is also commonly called co-pay. And this is the percentage that the insured person, what you will pay after the deductible is paid. So like we just talked about in that example, you pay $250 and then the insurance company will pay the rest. But in many cases, the insurance company doesn't pay for all of it. They will pay for a percentage of it. For example, if co-insurance equals 20%, then the insured person pays 20% and the insurance company pays 80%. So on top of your deductible, you would need to pay 20%. So if you need to go to the doctor and get stitches for a cut you have, and it would cost you, let's say, $200, then you would have to pay for 20% of that. You'd pay $40 out of your own pocket, and the insurance company would pay for the rest of the amount. Each time that you go to the doctor after that, you have to pay 20% for each visit, each and everything that you do, because this is the agreement that you signed for with the insurance company. If you go into the doctor's office and you're checking in to see the doctor, you will probably see a sign there that says your copay must be paid before you check in. So right then when you go in, you have to pay the full amount it's going to cost, or the doctor will not see you. You can't say, I will pay the copay later. Copays need to be paid up front. You must be able to afford that amount. Expenses. Expenses are the costs for services such as surgery, hospitalization, x-rays, prescription drugs, and/or laboratory tests. All the extra things that go along with needing to go to the doctor for these services, those are your expenses. And you will see this written in any paperwork that you sign for your insurance. It will say things about expenses. So you need to know expenses just means the cost for these services. Claim. We've already used this word in several different cases. Just to make you understand, in the insurance world, when they're talking about a claim, it is what you make a demand for, meaning money, what you're asking for, under the terms of your insurance policy. Here we have a picture of a form that is a health insurance claim form. This is an example of something that you may fill out, something like this, that it will ask for all of your information and you'll have to write down exactly what your health problem is. You give it to your insurance company for their approval, and they will say if they will deny the claim, not pay for it, or if they will approve the claim, meaning they will pay for it. Now let's go over now some important questions to consider when selecting insurance. So you're going with an insurance provider. You need to know some important things. Does the health insurance plan cover both accidents and illnesses? So you need to know what your coverage is. What will they pay for? What is the service they will provide? Illnesses are when I get sick with something, I get the flu, or I get a sore throat. These are common illnesses. Maybe even something worse would be an illness of getting cancer. But does it also cover accidents? Things that accidentally happen, that I fell down the stairs. It is an accident. So does it cover both the illness and the accident? Which doctors and hospitals does the plan recognize? Am I allowed to go to certain doctors and certain hospitals? Will you pay for all of them or just some of them? Many times in America, your insurance will only pay for you to go to a certain hospital, a certain clinic. They have an agreement with that clinic. So you cannot just go to every and any hospital for medical care and expect them to pay for it. You have to go to the ones that they will recognize. And many people do not like this because they think that some doctors at some hospitals do not provide very good care and they would prefer others. So they choose their insurance based on which hospital they're allowed to go to. What are the exclusions and limitations? Let's look at the examples here. The maximum amount payable under this plan is limited to $50,000. Your limitation in this insurance plan is that we will only pay medical bills up to $50,000. If you need many surgeries because you were in a car accident and it costs more than $50,000, sorry, we're not going to pay for it. That's our limitation. It's the limit, the full way that we will go, $50,000. Okay, so you need to know what your limitations are. The second example, for expense incurred due to mental disorders, the plan will pay 50% of expense. So here we go, our exclusion. What it excludes, it does not include, it excludes. So to include is to say, we will take it in. Yes, we will pay for this. To exclude is to push it away and to say, no, we will not pay for this. So the exclusion in this case, what they're saying, no, we will not pay for, is mental disorder. So any doctor bill that you may have because you have to go to a psychiatrist or a psychologist, you have a mental problem, they're saying we only pay 50% of that bill. You have to pay the other 50%. And many insurance companies will do this. They do not consider mental illness very important, so they will not pay for you to go to the psychiatrist.
Travel insurance is boring. It's not the exciting part of traveling, the meeting new people, seeing new places, opportunities around every corner, everything so new. Yet you just spent the last however long watching lectures on travel insurance. It may take away from the fun experience of traveling, yet you just learned some good vocabulary to help yourself knowing more about travel insurance. And the one thing to take away that you should remember is healthcare in America is expensive.